Topicals and phototherapy did not get me the results I had hoped for. I was ready for change. I wanted to be better. My dermatologist explained to me that Skyrizi was the best option for me to get clearer skin. As the existing plaques began to clear, each day was more exciting. At 4 months, I was perfectly clear. I had a wedding to go to. My skin was clear, and I felt amazing in my green dress. I took pictures with everyone. Anybody had a camera, I was there.
Use and important safety information. Skyrizi, risankizumab-rzaa use. Skyrizi is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy. Important safety information. What is the most important information I should know about Skyrizi, risankizumab-rzaa? Skyrizi is a prescription medicine that may cause serious side effects, including serious allergic reactions. Stop using Skyrizi and get emergency medical help right away if you get any of the following symptoms of a serious allergic reaction: fainting, dizziness, feeling lightheaded, low blood pressure, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash, hives, itching. Infections. Skyrizi may lower the ability of your immune system to fight infections and may increase your risk of infections. Your healthcare provider should check you for infections and tuberculosis, TB, before starting treatment with Skyrizi and may treat you for TB before you begin treatment with Skyrizi if you have a history of TB or have active TB. Your healthcare provider should watch you closely for signs and symptoms of TB during and after treatment with Skyrizi. Tell your healthcare provider right away if you have an infection or have symptoms of an infection, including fever, sweats or chills, cough, shortness of breath, blood in your mucus, phlegm, muscle aches, warm, red, or painful skin or sores on your body different from your psoriasis, weight loss, diarrhea or stomach pain, burning when you urinate or urinating more often than normal. Do not use Skyrizi if you are allergic to risankizumab-rzaa or any of the ingredients in Skyrizi. See the medication guide or consumer brief summary for a complete list of ingredients. Before using Skyrizi, tell your healthcare provider about all of your medical conditions, including if you have any of the conditions or symptoms listed in the section, "What is the most important information I should know about Skyrizi?" Have an infection that does not go away or that keeps coming back. Have TB or have been in close contact with someone with TB. Have recently received or are scheduled to receive an immunization, vaccine. Medications that interact with the immune system may increase your risk of getting an infection after receiving live vaccines. You should avoid receiving live vaccines right before, during, or right after treatment with Skyrizi. Tell your healthcare provider that you are taking Skyrizi before receiving a vaccine. Are pregnant or plan to become pregnant. It is not known if Skyrizi can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Skyrizi passes into your breast milk. Become pregnant while taking Skyrizi. You are encouraged to enroll in the pregnancy registry, which is used to collect information about the health of you and your baby. Talk to your healthcare provider or call 1-877-302-2161 to enroll in this registry. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Skyrizi? Skyrizi may cause serious side effects. See, what is the most important information I should know about Skyrizi? The most common side effects of Skyrizi in people treated for plaque psoriasis and psoriatic arthritis include upper respiratory infections, headache, feeling tired, injection site reactions, and fungal skin infections. These are not all the possible side effects of Skyrizi. Call your doctor for medical advice about side effects. Use Skyrizi exactly as your healthcare provider tells you to use it. Skyrizi is available in a 150 mg per milliliter pre-filled syringe and pen. Please see the full prescribing information, including the medication guide for Skyrizi.